Hey guys, it's Hassa Suleiman and you're listening to Confessions of a Doctorholic. And in studio today is a good friend of mine and a doctor from the United States. We've got Dr. Audrey Gleeton.
Hi guys, nice to meet everybody.
All right, I'm going to ask you a few questions about how you got to where you are today. But firstly, I want to know what you're doing at the moment.
So at the moment, I am a global health fellow at the University of South Carolina. I'm a board certified family medicine physician in the United States of America. So a family physician in the United States is almost like a general practitioner. There's a little bit more nuance to it than that because we focus more on preventative medicine, but we're a broad specialty that sees everybody from what we call cradle to grave. So from infants all the way up into geriatrics.
All right, so considering you studied in the States, what was your medical degree like?
So my medical journey started off in Louisiana in the United States. I went to undergraduate at Louisiana State University and I studied microbiology with a minor in business.
And what were the prerequisites to get into that program?
My high school GPA and the ACT and the SAT scores that I got in America. And then once I had completed my undergraduate degree is whenever I applied to medical school, and I was accepted at the Louisiana State University Medical School in New Orleans. And that's where I completed a 4-year program, which is like a postgraduate program. And after completing that program, I registered with the match with the USMLE program. Okay. And that's how I was accepted at the Baton Rouge General Family Medicine Residency.
Okay, that whole thing went over my head. So let's break this into chunks. So let's start with the undergraduate program. So you said you had to sit the SATs. I only know this because of Suits, love that show. Hottest thing ever was Harvey Specter, just saying. Anyway, so you did that, and did you need to collect recommendation letters or write an essay to get into that program?
For undergraduate, I don't believe so. They may have changed that now. It has been a while. So I just remembered something. It does make a difference if you're applying to a private or a state undergraduate university. Private schools typically cost more money to apply to, cost more money for tuition, and they typically are the ones that require more of the recommendation letters and a little bit more background. Whereas state universities are provided by each individual state, and so they favor people who were born in that state before they look outside the state or outside the country. Just to give you an idea, if you're looking from outside the U.S., and it might be easier to get into a private university.
Was there anything else you needed to do to get in?
Yes, lots of things.
Spill.
So if you are at an American university, for sure, almost every single American university has a board for people that are applying to medical schools, and there is a recommendation letter that their board creates for you. And so you absolutely need to be friends with these people, know them, get this recommendation letter written well in advance, and they will include your GPA, any extracurricular activities that you've done, and any volunteer positions that you've done. So that is a required recommendation letter. If you don't get that letter, certainly admission programs will ask, why didn't you get this letter if you went to an American university? You do need other recommendation letters from other professors that you've been working with, or if you've ever worked in a lab, whoever oversaw you, that would be very helpful.
All right, so since you studied in the States, I'm assuming you had to sit the MCAT, is that right?
The MCAT is broken down into sections, and they do care about how high your score is within those sections. So say you score incredibly high on one portion and incredibly low on another, so it averages out to look like your raw score looks good, they actually still very much want it to be a pretty average number. They actually break those scores down into an individual equation, and some of the comprehension actually matters more because they found that people that have the comprehension section have higher scores, do better in medical school because they interpret history taking better. So that's why the portion is on the exam at all. But that goes into an equation with your GPA as well, and then any what they call X factors get brought in as well. So are you from another country? Are you a minority? Do you have any other special skills? Like, are you a student athlete that has gone through all of this training and all of this education as well as being a student athlete? Or do you have any published papers, anything like that, that goes into your X factor in your equation? And then that's kind of how they decide if they're going to pull your application out of what we call AMCAS. So AMCAS is the American Medical College Application Service that you upload all of your information to, and then you select which schools you're going to apply to. And there's a certain amount that are free, and then after that you have to pay to send them out anywhere.
Can I just say, every time you say X Factor, I'm imagining Simon Cowell in the corner going, eggs! And I mean, this sounds like great admissions.
I wish it was that fun. So basically, once you have submitted all of your information to AMCAS and they've done their equations on their side, they decide if they want to invite you for an interview, and then you go on the interview trail, interview with different people, and then you get ranked on a list. And so you could either be accepted outright, or maybe you have a wait list, which means that they've sent out a lot of applications, but they don't know if everybody's going to accept. So you might be able to move up the list and actually get a spot. So there's 3 options. You can either be accepted, waitlisted, or denied.
So why did you pick LSU over any other university? I mean, they've got an amazing footy team.
It's football.
Football,
Yeah.
American football. So I watched this American football game a couple of nights ago.
It blew her mind.
Honestly, not only is she a doctor, she explains those skills, whatever those athletes do, really well. And there was a blue line and a yellow line. I enjoyed that game, and I fell asleep afterwards.
It was a great game, actually. LSU beat Alabama. It was amazing. So I ended up choosing LSU for a couple of reasons. I did LSU as my undergraduate, and I chose LSU as my undergraduate because in Louisiana, they have something called a TOPS program, which is a tuition-based program for high school graduates from Louisiana. So my tuition was covered by the state, and that made it a much easier choice what school I would go to. Yeah. Both my parents are LSU alumni, and so I favored the school, and I, at the time, joined the swim team for a little while. And then for medical school postgraduate program, I chose LSU New Orleans. There are 2 LSU medical schools. One is in Shreveport, one is in New Orleans, and they're opening one in Baton Rouge in the next few years. I chose New Orleans because I appreciated their curriculum. The way it was set up at the time was in what they call a formal or a classical. So you did separate subjects. So the way they set up the subject would be for you to have like a pathology, physiology, everything separated, instead of now most programs do a systems based. You learn everything about the cardiovascular system. At the time, I thought I would learn better in the subject based, as well as the city of New Orleans is just way cooler than Shreveport.
So, because we're a 4-year program, the first 2 years we learn about the body, etc. And then the next 2 years are clinical. The first 2 years we've got PBL and we've got OSCEs every single year. And I'm just curious to know, what was the structure like at your school?
So things were set up a little bit differently whenever I went to medical school. Like we were talking about, I did more of the subject learning, so things were separated differently. And even now, talking to some people that I know that are going through the course now that it's changed to the system-based, it's still very much your first 2 years are basically all in the classroom. And so everything is lecture-based, anatomy lab-based, and then they are starting to integrate a few extra things. So we always had different classes. They were small group programs that it was 7 to 10 people at a time, but that was more for ethics discussions and for difficult cases. So we would practice with each other, but it wasn't a standardized patient necessarily. And then we would have other labs where we would go through things such as taking blood pressures or reading EKGs and things like that were in smaller groups. But we didn't do OSCEs until later. LSU does have a system that is a computer-based OSCE, which is not the same as an OSCE, but it's where you have cases. And so it's an online case program. And so each week you have to complete the program and get a certain score. Did you ask the correct questions? Do you do the correct physical exam things? And it's all on the computer.
All right, that's quite similar to us then. What happens during the final 2 years? Does everything move into hospitals?
Yes.
Okay.
In the second 2 years, everything changes over to clinical based. You basically have no lectures other than the lectures that the residents get in the hospital. And so things are broken up into 10-week blocks. And inside the 10-week blocks, they're broken up a little bit more than that. But you basically have your surgery, your GP, OB-GYN, which is obstetrics and labor and delivery, and then pediatrics and general practitioner. And that's how that 1 year is broken up into that. And your fourth year, you get a lot more autonomy to choose what you want to do for that time. So you can decide if you really enjoyed pediatrics, you can request to do basically an elective in pediatrics.
Did you feel like it was an abrupt transition, or did they ease you into it?
It was an abrupt transition, for sure. They are, from the complaints that our class brought up, they have changed things a little bit. So one of the things that they do is, I think it's every month and a half, 2 months, something like that. During your first and second year, you do go into the hospital and you take a history to try and get you a little bit more acclimated to speaking with patients and being in the hospital setting and learning how to take a history than that first day on third year rotation when you're terrified and you don't know what's happening.
All right, guys, I don't want the episode to be too long, so we're going to continue this next week. We're going to continue with what you need to use to study for the USMLE and what happens next.